The scan body is called RevEX, which stands for reverse extraoral scan body, because the whole process of scanning is done extraorally. The RevEX scan body is connected on the intaglio surface of the prosthesis, and then the whole process takes place extraorally. It's comfortable for the patient and very efficient for the clinician. The most efficient way to do the Straumann digital workflow implementing the reverse scan body technique is starting from the occlusal of the provisional prosthesis. And as we scan the occlusal, then we switch to the buccal. We head to the lingual. And finally, we end up on the intaglio surface of the provisional prosthesis. Our studies showed that when you implement the RevEX workflow starting from the occlusal surface, then you can achieve 100% accuracy of it if you use milling technology to fabricate the prosthesis prototype. The provisional prosthesis is the baseline for implementing the digital workflow using the RevEX. If the provisional prosthesis is not passively fitting, then the clinician needs to segment, section and reconnect the provisional prosthesis. This will be used after segmentation and reconnection for the complete digital workflow with the RevEX scan body. The advantage of using the RevEX workflow is that you can additionally fabricate a digitally designed and CAD/CAM milled or printed verification jig so that you can further verify your workflow at the prototype trying appointment. The provisional prosthesis is always the baseline when you implement the digital workflow using the RevEX scan body. Now, in the instance that the clinician needs to retighten the SRA abutments for whatever reason, then there might be a vertical discrepancy between the SRA abutment and the provisional prosthesis. In this scenario, the clinician needs again to section the prosthesis, reconnect it to achieve an accurately passively fitting prosthesis, which can be used for the RevEX workflow. The soft tissue scan is an integral part of the RevEX workflow. It will assist the lab technician to design the intaglio surface of the prototype prosthesis. However, there are challenges in terms of capturing the soft tissue. Usually, the edentulous mandible represents the biggest challenge, with the floor of the mouth and the tongue. A way to overcome this limitation is by using retraction, so the clinician can retract the tongue while scanning the edentulous ridge, and this way we can achieve more reliable soft tissue scanning of the edentulous ridge.